We are engaged in a range of research projects in the area of globalization and health equity. In the anchor area of innovation access for health technologies, we not only have the NIH project on building a technology trust in genomics, which has led us to look at various forms of pooling of intellectual property, as well as we have extended this analysis to rare disease work in the United States. So in fact, with working with one of our fellows, who's also an Echo Green fellow, Josh Summers, we've been engaged in looking at how tissue banks will in fact have freer exchange, or what are the barriers to exchange of the tissue bank samples. Oftentimes, the quantity and the quality of these biospecimens are absolutely critical to the research and development process for rare diseases. Yet, unfortunately for many scientists, this remains a significant barrier. So how can we study the exchange norms of these tissue banks? Well, we're going to be conducting a survey of these tissue bank practices in a way that hopefully will illuminate, we hope, the best ways in which to facilitate this exchange and also the recruitment of these biospecimens in a way that the work of these researchers can be unimpeded by the lack of access to biospecimens. We also work on projects in other areas, too, of globalization and health equity. Among them, we have another NIH grant that focuses on 7 countries in Southeast Asia. It builds on a partnership we have had long-standing ties with the Southeast Asian Tobacco Control Alliance and also with the American Cancer Society. And under that effort, we are trying to build the regional capacity for researchers in the region of Southeast Asia throughout the 7 countries to respond to the challenge of tobacco use in that region. Right now, it's an epidemic in that region of the world. And the challenge is, of course, how do you enable the researchers in that region to respond over the long period of time it will take to build the infrastructure to handle this issue of globalization, the movement of tobacco products so freely across borders. But oftentimes the consumer protections lag behind. Well, part of that actually is to make sure that they have the tools, the opportunity to work in regional efforts to engage on joint research efforts. And our first wave of research is on the illicit trade of tobacco in the region, which is, of course, a major problem for particularly policymakers who are faced oftentimes with industry arguments that, in fact, smuggling may result from increased taxation. Yet we do know that taxation on tobacco products is one of the most effective public health measures, and one of the key ways, of course, of reaching the poor in trying to address the growing marketing of tobacco in these countries. Another project we finished recently was with UNICEF. It was a bit of a departure from our usual sort of area of work in that it focused on a product of nutrition, ready-to-use therapeutic foods such as plum peanut. And UNICEF had commissioned us to look at the issue of the supply chain of ready-to-use therapeutic foods into the Horn of Africa. And in partnering with some of our colleagues at the University of North Carolina School of Business, as well as drawing upon some of the expertise in the faculty ranks of both UNC as well as Duke, we put together a team that was looking at this issue, particularly focusing on Kenya and Somalia. I think there are several ways in which we hope the program will grow. The program has, over the years, gained greater maturity in the sense that we're called upon more often to provide policy inputs to a wide range of stakeholders. And this has been, of course, very gratifying both for our program as a whole and certainly for the students who work with us. And by providing opportunities for students to work with us on these projects, I think we hope that we can give them an early taste of what a career might be in global health.